Warm greetings to all viewers. It is indeed a pleasure to have you with us yet again. एफबी पर लॉग इन हुए तमाम दर्शक मित्रों को मेरी हार्दिक शुभकामनाएं। अपोलो हॉस्पिटल्स द्वारा आयोजित स्वास्थ्य संबंधित बातचीत में आपका स्वागत है। जैसे कि आपको ज्ञात होगा, वर्ल्ड एलर्जी ऑर्गेनाइजेशन के द्वारा ये सप्ताह वर्ल्ड एलर्जी अवेयरनेस वीक घोषित किया गया है और सालाना इस सप्ताह में ज्यादा से ज्यादा एलर्जी संबंधित जागरूकता के कार्यक्रमों का आयोजन किया जाता है, जिससे कि जनहित हो सके। ऐसा ही एक उद्देश्य लेके आज इस एफबी लाइव सेशन कार्यक्रम का आयोजन किया गया है, जिसमें हमारे साथ जुड़े हैं एलर्जी विशेषज्ञ डॉक्टर राजेन त्रिवेदी। डॉक्टर राजेन त्रिवेदी सन 2013 से अपोलो हॉस्पिटल के साथ संयोजित हैं और तमाम दर्दियों की एलर्जी संबंधित जटिलताओं और परेशानियों का निवारण करने के लिए निष्ठापूर्ण और दृढ़ संकल्प के साथ कार्यशील है। डॉक्टर राजेन त्रिवेदी एलर्जी और अस्थमा संबंधित समस्याओं में निपुण है। उन्होंने अमेरिकन एकेडमी ऑफ एलर्जी, अस्थमा एंड इम्यूनोलॉजी यूएसए से अपनी फेलोशिप संपन्न की है और फेलो है। डॉक्टर, आपका हार्दिक स्वागत है।
Thank you for inviting me for this opportunity, and welcome to FP Live. For this is the session for World Allergy Week, and this is declared by World Allergy Organization. And World Allergy Organization is every year they declare 1 week in the month of April for this awareness of the allergic diseases. And why should they do that kind of thing? Because the allergic diseases are one of the commonest diseases one of the commonest chronic diseases in the non-communicable diseases. So if you look at the diseases like communicable diseases, like infections, the communicable disease, you can pass from one person to other person. Whereas non-communicable diseases like diabetes, high blood pressure, cardiovascular disease, allergic diseases, amongst those diseases, one of the commonest is allergic diseases. And so what? Well, allergic diseases is so chronic that it simply just makes life miserable many a times. It reduces the productivity at all ages actually. The children, they cannot concentrate in the school, they cannot do homework at home. They feel miserable from respiratory diseases or whatever allergic they are to. Adults can also suffer. If someone has got a cold, for example, just for a few days, how miserable one feels. And if the allergic nasal problem keeps on going, or the lung problems keeps on going, or how the life could be the miserable. So to increase the awareness for that, the World Health Organization has declared this year, for the awareness.
थैंक यू सर। हमारे दर्शक मित्रों को एक बार फिर से ज्ञात कराना चाहूंगी कि आप हमें एफबी पर लाइव सुन रहे हैं और देख रहे हैं। सेशन के दरमियान आप एलर्जी संबंधित अपने प्रश्न डॉक्टर राजेन के समक्ष रख सकते हैं। उसके लिए आपको कमेंट बॉक्स में कमेंट करना रहेगा। सो सर, लेट अस स्टार्ट विद आवर फर्स्ट क्वेश्चन टू बी एड्रेस्ड ऑन। सर, एलर्जी क्या है? व्हाट इज एलर्जी?
Okay, allergic reaction is an immune reaction. Our body protects us through a very complicated and complex immune system. Part of it is the antibody protection. So we fight back, for example, we fight back infection by producing antibodies. So there are 5 types of antibody. And one of them, to simplify, just call it allergy antibody or immunoglobulin E or E antibody. And that is very specific E antibody against the substances that one could be allergic to. So it's an immune reaction. It's not that one is immune deficient. It's an immune reaction which is rather not needed. The production of E or allergy antibody is probably meant to protect us, but instead is doing more harm to us rather than protecting us. So that's how the allergy is produced.
Okay. So after that, how, does the allergy stay for a lifetime?
Okay, that's a very good question. As the reason one gets allergy is that two actually predisposing factors are required. One is the genetic tendency. So आपके कोई जो family history हो तो that suggests that there is some genetic tendency. और जिस तत्व की एलर्जी हो सकती है तो उनके साथ जो कॉन्ट्रैक्ट है आपका, सो दोज टू प्री डिस्पोजिंग फैक्टर उनका जब मिलावट हो जाए तब किसी को भी एलर्जी शुरू हो सकती है, कोई भी एज में। ज़्यादातर बच्चों में ज़्यादा शुरू होती है, और जब शुरू होती है बच्चों में तो हो सकता है वो स्किन एलर्जी हो लाइक एक्जिमा और एटोपिक डर्मेटाइटिस, एंड दैट कैन सो कॉल्ड एलर्जी मार्च। सो स्किन एलर्जी लाइक एटोपिक डर्मेटाइटिस टू एलर्जिक राइनाइटिस, जो नेजल प्रॉब्लम हो सकता है, बाद में जो अस्थमा हो सकता है, दमा की बीमारी और हाफानी, और उसके बाद जो हो सकता है उसके साथ भी हो सकता है वो फूड एलर्जी भी हो सकती है। तो वो एलर्जिक माँ, जो एलर्जिक कुछ बोलते हैं उसको हम लोग, तो सो दैट इज हाउ द एलर्जी इज प्रोड्यूस्ड काइंड ऑफ थिंग।
Okay.
So as it is anuvanshik, as it is genetically related, as such, there is no cure for that as such. It can fluctuate throughout the life. It may, for a year, after some time, may disappear. One, it may never come back, or it may come back. So it can fluctuate throughout the life. So there is no cure as such. However, there are some controlling medication available, and we can try to modify this immune response in a way so that this allergic reaction is reduced or almost eliminated kind of thing. So that's how हो सकता है मैंने जो आपने सुन लिया होगा कि whatever I was talking about the respiratory illnesses, तो बाद में जो इंटेस्टाइन जो सिम्टम्स होते हैं जो फूड के बारे में, फूड एलर्जी के, तो उसमें जो वॉमिटिंग हो सकता है, पेट में दर्द हो सकता है, डायरिया हो सकता है, और इन एक्सट्रीम केसेस एनाफिलेक्टिक शॉक भी हो सकता है उसमें, विच इज खूब भयानक हो सकता है, लाइफ भी चला जा सकता है उसमें। हाँ, तो सो दूसरी उसके बाद है एक जो मधुमक्खी जैसे जंतु है उनका जहर की भी एलर्जी हो सकती है। तो वो एकदम कॉमन नहीं है, जिस लोग को जो होती है वो एकदम माइल्ड भी हो सकती है, जनरलाइज माइल्ड रिएक्शन भी हो सकता है, और इट कैन ऑल्सो बी एन एनाफिलेक्टिक शॉक जिसमें लोग क्लास भी हो सकते हैं। तो सो वो अनुवंशिक नहीं होते, लेकिन किसी को भी हो सकते हो। और जो लास्टली है वो ड्रग एलर्जी। ड्रग एलर्जी जिस लोग को एलर्जी है, एलर्जी की टेंडेंसी है, तो इन लोग को ड्रग एलर्जी होने की संभावना ज़्यादा है ऐसा नहीं है। लेकिन जो लोग को एलर्जी है और उनको जो ड्रग एलर्जी हुई तो उनका जो रिएक्शन है वो ज़्यादा होने की संभावना ज़्यादा हो सकती है। सो दोज आर द सिम्पटम्स। ड्रग एलर्जी सिम्पटम्स कुड बी वेरी वेराइड, any organ could be involved. So it's a big description for that. So drug allergy can manifest any way kind of thing. स्किन है, जो रेस्पिरेटरी ट्रैक है, इंटेस्टाइन में जो सब कुछ पता है आपको, उसमें से कोई भी हो सकता है, वो ऑर्गन डैमेज भी हो सकती है। और जो ड्रग एलर्जी है वो 4 टाइप्स की होती है ज़्यादातर, 5वां टाइप भी है लेकिन ज़्यादातर 4 टाइप्स की होती है। उसमें टाइप 1 जो इमीडिएट रिएक्शन बोला जाता है, और टाइप 4 जो डिलेड रिएक्शन बोला जाता है, वो ज़्यादातर महसूस होता है।
Okay, sir. Sir, actually, we had few comments from our viewers. So there were 3 questions mainly. So one question was, what are the symptoms of the seasonal allergies? I think you already covered that
Yes,
in
that's
what you
correct.
just said.
Severe allergy means miserable nasal symptoms, itching of the eyes. One thing is important, that if you keep on itching and itching and itching, now it can affect your cornea, and sometimes it may be required an ophthalmologic evaluation. So you don't get your cornea affected sometimes in extreme cases. So when you ask me about what could be the severe symptoms, so yes, other severe symptoms about asthma could be very severe kind of thing. So yes, it could be severe. People die from asthma. That's correct. Uncontrollable asthma can lead to death. That's correct. So it is very important to control asthma. And there are medications which are control medication as well as rescue medication. Of course, it is in detail, but this is in short. Other is a food allergy, जो मैंने अभी बताया आपको. So one can have real bad reaction from like anaphylactic shock, which can occur 2 to 3 hours after taking the food. Sometimes anaphylactic shock from the food is associated with exercise only. So without exercise, one does not get any reaction from that food, and exercise alone does not get any trouble. But when that particular food and the exercise, when they are combined within 2 to 4 hours, then one can get mild to severe reaction. That one needs to understand.
Okay. So the same viewer had asked yet another question. He asked that is stress one of the trigger factors for allergy?
I beg your pardon?
Is stress one of the trigger
Stress.
factor? Yeah.
Now, stress make you feel little worse. It does not precipitate. One thing is that emotional ups and downs, if one got asthma, then yes, emotion will have some effect on asthma. That's correct, kind of thing. So it can aggravate or it can make you feel more symptomatic. That's true. But will it cause allergy? No.
Okay. Sir, there was one another question that was what is the difference between allergy and cold?
That's a very good question. The allergy symptoms are chronic. Cold is just for a few days. Sometimes it mimics. The person who has got allergy, it is very difficult for that person or even the physician to distinguish between two, because both of them, if upper respiratory symptoms we are talking about, they both get sneezing, itching in the throat, but in cold symptoms, one gets sometimes the pain in the neck, in the sense the glands could be swollen. That's the extra features one can get. But you can also get that in allergy as well. Fever is generally not associated with allergy. So if there is a fever, that suggests more of an infection kind of thing. But on a long term, cold will last for about 7 days or so, maybe a little more. But allergy symptoms without any control medication will continue for a length of time. So that's the difference between the cold and the nasal allergy.
Okay. So coming to the other question, what are the inhalants or the substances that may trigger allergy? Like as you just mentioned, that stress, whether it's inclusive or not. So similarly, are there any other inhalant substances?
Yes,
that
there
may
are
trigger?
several. The most common inhalant substance which is responsible throughout the world is a dust mite allergy. That means house dust mite. We call it HDM, house dust mites. So घर की जो धूल है वही उसकी घर की धूल नहीं, लेकिन उसमें जो एक जीवात है, we call it mite, house dust mite. That is one of the major problem throughout the world. Okay. The warmth and the humidity will increase the growth of house dust mite. It can reside in furniture, upholstery kind of thing, in the bedroom when there is a cotton bed, रुई जो पड़ा हुआ है ना वो जो blanket है रुई वाला उसमें भी होती है वो. So that's one of the major problems. So that's one inhalant. Other inhalant could be the pollens, like grass pollens or wheat pollens or tree pollens. So pollens could be responsible for allergic manifestation. And that vary according to the region of the world kind of thing. Other thing which could be is the mold, that is fungus. The fungal spore जो फूड के बीज होते हैं ना वो हवा में फ्लोटिंग रहते हैं, वो हम सांस में लेते हैं, तो उनकी एलर्जी भी हो सकती है जो अस्थमा वगैरह कर सकती है. सो दैट्स इनहेलेंट. और बाकी रहा है वो जो कुत्ता, बिल्ली, कॉकरोच वगैरह वगैरह और एनिमल्स लाइक रोडेंट्स, लाइक जो रैट्स और माइस होते हैं उसकी भी एलर्जी भी हो सकती है. सो दोज आर द मेजर इनहेलेंट एलर्जेंस सो फार. There are many, but inhalant allergens. One could be having allergy.
Okay. So, sir, I think there is one more question from the viewer that is in context to the same. He asked whether any milk products they have any specific reason for creating the allergy.
Milk product allergy generally starts in the childhood. Of course, one should not mix milk sensitivity with IgE. What I'm saying is there are two kinds of reaction बच्चों के लिए होते हैं. One is non-IgE mediated milk or other protein sensitivity, and other is जो allergy बोलते हो milk allergy, which is really allergy, IgE mediated milk allergy. So just like any other allergy, yes, बच्चों लोग cow milk allergy हो सकती है उनको. So question is why one develops that? Just due to genetic tendency, any allergic tendency. Allergy, as I just say, allergy is not only nose and lungs and kind of it is related to the food. और बच्चों में जो eczema और atopic dermatitis हो गई तो उनको food allergy होने की संभावना ज़्यादा है. तो वो समझना चाहिए. I'm not saying they will definitely be allergic to the food, but उनको food allergy होने की संभावना ज़्यादा है. वो नहीं हो फिर भी milk allergy होती है. So most common food allergy in children are said to be milk, wheat, egg, soy, and as they grow, they tend to disappear. Maybe by adolescent, 15-16 साल जिसे होते हैं ना, तब वो चले जाने की संभावना ज़्यादा होती है बच्चों में. हाँ, एक एलर्जी जो होती है जो ट्री नट एलर्जी और द सिंगदाना, that is the peanut allergy, if they develop that, they tend to remain throughout the life. I'm not saying 100%, but most likely it will remain throughout the life, and it can also develop in adults as well. Any allergy can develop in adults as well.
Okay, sir. So, sir, I think so that brings us to our next question. Like, what are the kinds or the types of allergy that are mainly prevalent amongst the population?
I think we just discussed it briefly in the sense that it could be inhalant allergy, it's a different manifestation of the respiratory tract kind of thing. Inhalant allergy rarely can affect the skin as well, causing atopic dermatitis. Mostly, one manifestation which I didn't discuss much was about atopic dermatitis. And atopic dermatitis, which about 90% of the time develops before the age of 5 years. It can develop in adult as well, or may have developed in children. They grew out of it to an extent and develop again in adults. If it is developed de novo in adults, then we have to think of other possibility as well. That's beside the point. But point is skin condition, eczema or atopic dermatitis in children. Yes, it is due to a barrier dysfunction of the skin. What happens is we lose water from the skin. The people with atopic dermatitis tend to. Good. So let's start all over again from that question. So what kind of what type of allergies? Mostly about inhalant allergies, everything we discussed. But let me go through that again briefly. So starting with inhalant allergens, that affects mostly our respiratory tract. So people have sneezing, itching in the nose, itching in the throat, itchy eyes, itching inside the ear. So those are the symptoms for that. Itching of the eyes could be very, very severe at times. And I just said, I think before, that if it is real chronic itching and swelling around the eyes, if it is affecting the cornea, one needs to see the ophthalmology, because sometimes it can affect cornea, called keratoconus kind of thing. So that in a rare situation, but one needs to be aware of that. So that's the inhalant allergy. Of course, asthma is there in inhalant allergies. One point I'd like to mention, which I may not have mentioned before, all the symptoms which are suggestive of allergy and asthma could be both condition, similar symptoms could be non-allergic as well. So what is non-allergy? Let me talk about that here. And this is a good question actually when you ask me this kind of thing. So what are the substances responsible for non-allergic, or rather what is non-allergic symptoms, or non-allergic nasal problem, eye problem, or lung problem? So non-allergic symptoms are similar, looks like allergic, but the reason is not allergic. So that those symptoms are not so-called allergy antibody, IgE mediated. There are physical and chemical irritants like perfumes, smoke particles, or smoke, or air pollution like traffic pollutions that can affect our respiratory system, be it nose or eyes, or of course, eye is not a respiratory system, but in nearby that, and the lung kind of thing. So those can have physical and chemical irritant effect. One of the examples would be cooking fumes kind of thing. So one is not allergic to those things, but it's the irritant effect on our system, which looks like allergy kind of thing. Same thing applies to the lung in the sense that people can have non-allergic asthma. If you do any allergy testing and everything, it will be negative totally, called intrinsic asthma as well. So that is non-allergic component as well. Many a time people have both of them. One is allergy inflammation ongoing, and on the top of it, all this irritant physical and chemical particle will deposit and cause more inflammation kind of thing. One important point at this point is the diesel particles, the diesel fine particle. We are not talking about visible particle, we are talking about non-visible, less than 2.5 micron in size, or even less than 1 micron in size. They are sometimes devastating. They themselves don't cause allergy. But if someone has got allergy symptoms, that is specific IgE production. What is specific IgE? Specific IgE is the IgE against specific substance one is allergic to. I'm not talking about total IgE, however high it is, doesn't matter. It's a specific IgE. So diesel particle appear to stimulate the production, ongoing production, not initiating, but ongoing production of that specific IgE. So diesel particle, the diesel fumes could be really bad to us as well, apart from other non-specific bad effect on our respiratory tract. So those are the inhalant allergies we are talking about. Now next comes the food allergy kind of thing. So food allergy could be varying symptoms, as I just discussed. It could be just vomiting, pain in abdomen, and diarrhea, etc. Depending upon that, one is important thing one needs to keep in mind that it could be dangerous as well, because sometimes very sensitive people can get into anaphylactic shock. That's very important thing. Other thing is that sometimes food is associated with exercise. That means food alone, a specific food alone, does not cause the allergic reaction at all. One can safely consume that food, as well as exercise alone doesn't cause any problem. But food and exercise together within 2 to 4 hours can cause real bad reaction, anaphylactic shock even kind of thing. So it is not that common, but just to be aware of that, that's all kind of thing. All right, so that's a food allergy. Next comes another dangerous allergy is not that common, but it is there in India, and that is insect venom, stinging insect venom allergy. That is like honeybee, मधुमक्खी बोलते हैं ना वो मधुमक्खी और wasp और भमरी जो बोलते हैं वो दूसरा हिंदी तो नहीं आता है मुझे लेकिन तो भमरी so those kind of insect venom they can cause a local reaction, which is nothing to worry about that. Local reactions are common and just a little itching, swelling there, nothing to worry about that, no concern about that. But it can cause mild to severe generalized reaction. So when that is there, one needs really a medical attention, it needs real evaluation because it could be real dangerous and one can be protected from that. One way is to just carry an adrenaline injection all the time with the person, which can save life. With the antihistamine pill, first and foremost is the injection. So that's the insect venom allergy manifestation. Other thing which I did discuss, not much in detail, was the skin allergy kind of thing. So eczema or atopic dermatitis. That develops 90% of the time in children before the age of 5. It can develop in adult as well, but if it develops de novo, in the sense without any allergy history in the past, if an adult develops, Other possibilities should be ruled out. Of course, consider the allergy as well, but other possibility, skin condition I'm talking about, should be ruled out as well. So it is very important. Now, why people get eczema or atopic dermatitis, and why it is important? Because it can lead to atopic mark, as I just discussed earlier, that atopic dermatitis can lead to food allergy or allergic rhinitis or asthma or all combination of different things or all together. So atopic mark. And reason one develops atopic dermatitis is the dysfunction of the barrier mechanism of the skin, which is kind of genetically mechanism kind of thing. So what happens that our skin in that condition loses water quickly kind of thing. So that's one important point. And that leads to other consequences. It also exposes to airborne allergens, which could be food allergens as well as like pollens kind of thing, other airborne allergens. And that can sensitize the person to those allergens, and then other allergy develop kind of thing. So that's skin allergy manifestation as such in atopic dermatitis. Um,
So,
yeah.
sir, as you had been talking about the anaphylactic shock, and also you had been talking about carrying the antihistamine. So, in similar context, we have got a comment from one of the viewer. He asked that does allergy create any emergency situation? That's
Yes,
what he's
anaphylactic shock, asthma is an emergency situation. Yes, asthma, let me talk about asthma. Asthma should be controlled. It could be very mild, requiring only rescue medicine occasionally to it could be very severe, and it requires proper follow-up. One important sentence I would say is just feeling better may not be enough to suggest that asthma is under control. It requires proper follow-up periodically with the following physician, to your physician. It's very important. So there are rescue medications, and if required, control medication. Rescue medication is when you start wheezing or kind of thing. So there are some dose guidelines for that. And then if there is a continuous inflammation, allergic inflammation in the airways, as realized by history or the lung function test, then you may need to take control medication regularly. That's very important to understand. And that could be emergency. People may need to go to the emergency room frequently if it is not controlled. Can it lead to death? Yes, people can die from uncontrolled asthma. That's true. It can also affect quality of the life, whatever severity it is. It can affect the quality of the life as well. So asthma control, yes, it could be an emergency as well. Other emergencies are, just I said, anaphylactic shock from anything, food allergy, for example, or exercise-induced food-related anaphylactic shock. Occasionally, people get exercise-induced anaphylaxis without food. That's also a part of it. So yes, that's an allergy emergency as well. Insect sting allergy, anaphylactic shock, that's an emergency, yes. In those food and insect sting, one needs to carry that injection as guided by the physician, adrenaline injection. That's very important to understand. So yes, there could be, and these are the examples of emergency in allergy situation.
Okay. So, sir, yet we have another question from the same viewer. He asked whether there are any pediatric allergic triggers, any specific pediatric allergy triggers, he says.
Pediatric allergy or the adult allergy triggers are more or less same. If we talk about aeroallergens, which we inhale in our nose and lungs and everything, so triggers. So mostly it is the house dust mite, if it is there. I'm not saying, but most common throughout the world is one of the major problems. I wouldn't say most common. One of the major problems throughout the world is house dust mite. Yes, and other things are dust. Sorry, not the dust itself. It's a house dust mite, but the fungal spores. If there is a high humidity, like in Mumbai, for example, Kolkata, Hyderabad, where there is high humidity. So anywhere there's moisture in the air, much more, there will be a growth of the mold. Even in the dry places, if there's water leakage in the house, the walls are smeared with water, kind of thing, water leaking there, or in the bathroom, it is always wet, you will find a growth of the mold, that is fungus. And the fungal spore, the फूग के बीज होते हैं वो, so they remain floated in the air, and that can affect the child or an adult and cause an allergy problem from that. So, and the food allergies, which is more common in children to start with, so it could be leading to respiratory problem as well as skin problem as well as intestinal problem. So food allergy, most common food, as I just said before, will be milk, soy, egg, wheat. Those are the most common, and children tend to grow out of it gradually. Not all of them, but roughly about 80% tend to grow out of it, kind of thing. Other things are like peanut and tree nut, like walnut, pecan, almond. Those are the tree nuts, and those allergies, if one develops, tend to remain through the life. Some very rare, some people get out of it, but not most of them. So, and that also affects the adult as well. Fish is another allergy. That is the simple fish, that is bony fish, as well as a shellfish, crustacean and other shellfish like clams, mollusks, that kind of thing. So those are the common food allergens. Say about 90% of the food allergy in the whole world is between these 8 food I just talked about. There are thousands of food otherwise. But in pediatric, any, like an adult, it is the same thing, but pediatric, yes, they are more exposed in a way to an extent about this atopic dermatitis. If they develop, then they get more problems.
Okay. So, sir, I think so that pretty much answers also the another question from the viewer that she had asked about what food allergies are more prevalent.
Right.
So,
That's
you all
correct.
just summed
Yes,
that out.
that's correct.
Yes, sir. Moving on to the next question, how do one diagnose the allergy in general, sir? Like,
Okay.
how do I know whether I'm allergic to something, sir?
Okay, I think we briefly discussed, but let me go through that again. If one has got symptoms, then we evaluate that person. Symptoms suggestive of allergy. If someone does not have any symptoms suggestive of allergy, then there is no need to go any further. So the clinician, that is a physician, evaluates the patient, and examination history, detailed history, and examination is suggestive of allergy, then we proceed further for investigations. There is no, if someone does not have any symptoms or clinical suggestion of that, there is no need for any screening test, because positive test does not mean one has allergy. Positive test may remain throughout life without causing any problem. As of now, we don't recommend that. Allergy literature, the world allergy literature does not recommend screening as such, except for research work. That's a separate issue altogether. We are talking about practical issues here. So if there is a sign, signs and symptoms suggestive of allergy, we go further. And how do we find that out, how one is allergic to? So in case of inhalant allergens, if I talk about, so inhalant allergens are, we go for the regionally selected inhalant allergen. Himalayan area will have different pollens, for example, compared to western part of the country, kind of thing. So the regional selection is important, not the whole country kind of thing. Moisture, where the area is more moist, for example, Mumbai or Kolkata or Hyderabad, I just said there are more mold, so it is more appropriate to check for the mold allergy more extensively rather than in dry area. So selected allergen testing for the inhalant, we can check for the skin test or the lab test. As I just said before, the skin test is considered the gold standard for allergy evaluation. And there are lab tests if the skin test cannot be performed for skin condition, or if the medications are taken, the test is required urgently, then yes, we can do the lab test as well. Or if the patient doesn't want the skin test, fear of having done the skin test, then we can opt for the lab test. So a reliable lab test can be done with those selected antigen if available, kind of thing. So those for the inhalant. For the food, the World Allergy literature recommends not to do any screening test for the food as such. If there is a doubt for any particular food, then check for that food. That's important. Screening test for the food and having positive tests for certain food without having any clinical relevancy can cause a little bit of harm to the person in the sense that not in by doing the skin test or lab test, but it can affect in a way that, let me give an example. If I don't have any allergy, whatever I eat, if I do the food test, whether skin test or the lab test, and it turns out to be positive, although I am consuming all those food, nothing happens. So that positive test does not have any meaning, but it will introduce the idea in my mind that I'm allergic to that food, and I will stop eating unnecessarily that kind of food, and it will affect my nutrition and being harmful to me. So that is a potentiality for a harm to the person. So unnecessarily doing the food test kind of thing. So that's why the World Allergy literature uh, suggests not to do a screening test for the food as such, but only the suspected food test. Yes, there are situations we can just ask lots of questions, and if we feel that there is a need for the food test, but we cannot get around, so after asking and narrowing down, we can do a limited screening test for the food as well. So that's one thing. For now, the next will be in the line will be the insect venom we just talked about. It's a venom allergy testing, which is a skin test, which is the gold standard again and most reliable. And what happens is that material, the standardized material for the venom skin testing is not available in India. So we have to rely on the reliable lab test for that. Um, that kind of, so that's also very important. One important thing, like which I did not mention before, is if someone has got insect venom sting allergy like honeybee, madhumaki, then it is important to evaluate a little further, because the reason is sometimes this condition is associated with systemic other disease which should be evaluated, systemic hematological disease, namely mastocytosis. So there is some possibility of that person having that. So it is suggested if someone has got honeybee or that kind of insect reaction, one should think of little further evaluation, which is simple blood test kind of thing, tryptase kind of thing, check for that. So that point I just wanted to mention it to be aware of that. That's all.
Exactly, sir. Sir, so we have got one more question from the viewer. The person asks, what if we ignore the allergy?
Well, if we ignore the allergy, then the suffering is there. Again, at the beginning when I said it's a loss of work, a loss of the school. It can keep on getting worse and worse. And now, depending upon what kind of allergy it is, if it is just limited to the upper respiratory problem, that is just nose and eyes, then it's just a miserable life. We keep on sneezing and sneezing, itching in the nose, itching in the throat, and that kind of thing. If it is asthma, then one can get real bad. It is very important to control it. One should not ignore it at all. It is actually nobody should ignore anything, because the miserable lifestyle will lead to the bad quality of the life. You may not be able to enjoy anything in the life. When you are in a group together, then you will not be able to enjoy it because you are sneezing or some other symptoms are there. People will keep looking at you. That's a social issue as well sometimes. Not always, but sometimes. If it is food allergy, then of course only treatment for the food allergy recommended right now is the avoidance of the food. So food allergy is very important to understand, And depending upon the severity, one needs to take appropriate precaution, like carrying the adrenaline injection if it is very severe kind of reaction. If it is a mild reaction currently, it may turn out to be a very severe reaction next time. So that needs to be understood as well, kind of thing. So we advise to carry adrenaline injection based on the history and how we feel safe about it, that kind of thing. So the food allergy you cannot ignore as such. You have to read the small print label as well, depending upon the severity. Sometimes it is dose related as well, mild symptoms if we talk about. So no, you cannot ignore that part as well. Venom, no, should not be ignored. It's a life-threatening reaction to that. So you should not ignore the venom allergy at all. One must, although we don't have means to treat venom allergy with the standardized products in India, because it's not available in India, the injection therapy. But one must carry the adrenaline injection with person. So one should not ignore that part. Drug allergy, you can never ignore that because that can lead to bad reaction, and that requires proper history and clinical evaluation, that kind of thing.
Sure, sir. Sir, so not we should never ignore the allergy.
You should
That is
not
the
ignore.
strong
That's the
message.
point. Yeah,
Yes,
that's
sir.
the message.
Sir, so one viewer has one more question, and he says that how to avoid allergy in the present lifestyle in the modern era. So I think so. How should one manage the allergy, sir? Basically, that
Okay,
is the
that's good.
question.
So main question is how to avoid, because avoidance is the key advice for the allergy, because there is no cure. If you can avoid the exposure to something you are allergic to, then you're fine. But how to avoid it? Pollens, for example. How can you avoid pollen? You go out and you can't avoid. You inhale that. So that's a good question, but very difficult to answer. How to avoid pollens? One thing is that, for example, if you're traveling in a car, then you can keep the windows closed all the time, and that will be exposure will be much less to the pollens if you are sensitive to the pollens. If you are not sensitive to pollen, you don't need to worry about that. House dust mite, which is one of the major problems in the world. Yes, precautions must be taken for that, and they are available to reduce the exposure, not eliminate. It's not possible to eliminate, but it is possible to reduce the exposure. And when we say reduce the exposure, it should be kind of a global in the house, not just one room kind of thing, precaution. It should be precaution everywhere kind of thing. So removing rather putting the dust-proof or mite-proof covering around the mattress that is your bed, but you continue using the रुई भरा हुआ जो गद्दी होती है ना for your blanket kind of thing, that's not good idea. You have to avoid so